Well, we have a very distinguished guest in our studio this afternoon. Is Dr. Ronald Wheeler, a urologist here in Sarasota, and he's just written a book called Men at Risk, The Dirty Little Secret. And thank you so much for joining us this afternoon. But that's a very powerful statement the title makes. So what is this book about?
Well, this book is really about the changes that need to come with urology. Urology right now is old-fashioned. We've been doing things the old-fashioned way. This book actually is comprehensive, very complex, and it's contentious. Doctors are not going to like this book because it's going to challenge them. Patients are going to take this book and they're going to read this book to understand the topic. Patients need to defend themselves from the doctors, from the topic. So the bottom line is it goes hand in hand. So patients can no longer go into the doctor's office, as an example, and say, "Doc, what do I need to do?" And the patient has a high PSA, as an example. And the doctor says, "Well, I'm going to schedule you next Wednesday for a biopsy." And the patient says, "Okay." Well, that's got to stop. And the reason is, as this book points out, prostate biopsies, as example, cause prostate cancer cells, when encountered, to spread.
That's a scary topic right there. That's a scary concept to actually comprehend, but that is a big crux of your book right there.
It really is. In Chapter 6, it really deals with that, and obviously it's well referenced for the urologists out there that want to learn and study what's going on about this topic. But from my point of view, again, it's so simple. When we lined up 10 docs, and they're all urologists, and ask them if needle tracking takes place, the answer from the consensus will be, no, it does not.
Right.
So what I would do is simply challenge them and say, okay, let's put a little bit of blood into our fingertip. And as we do that, let's take a needle and stick the fingertip. How many fingertips are you going to stick before you realize blood's coming out?
Yeah.
And you're going to say, you know what, this makes sense. So people say to me, you know, this is intuitive. Why don't doctors understand this? Well, I'm not certain why we don't understand it, but the business of doing biopsies is $2.4 billion a year. So all I'm saying is I'm going to lay the groundwork here.
Right.
The patients need to defend against it, and what we have to do is replace biopsies with imaging.
Right.
And imaging with MRI, magnetic resonance imaging. And it's interesting that prostate cancer, or better stated, the prostate itself in terms of imaging, is the only organ that we don't image. Every other organ radiologists image for us and tell us about that organ. With the prostate, we seem to think as doctors that we can take and covet that and treat it any way we want. Well, this is old-fashioned medicine. It's what I call conveyor belt medicine. We put patients on the conveyor belt and they do as they're told. The day and age of that has changed. It's altered. The landscape is altered with this book.
So let me ask you this, because I know you're going to an international conference of
Yes.
urologists tomorrow. You're leaving tomorrow for it.
Yes.
And this is almost as if, seems like a whistleblower book, so to speak, on that issue. So is this something you're unveiling there, and what do you hope will happen when that does happen?
We are unveiling the book, and I think more from my point of view is that I want to make doctors aware that if they don't pick up what I say in this book and make it a part of their daily routine in discussion of disease, in this case prostate cancer, with their patients, and be totally, actually provide full disclosure to their patients, that they could be liable for the inability to do that, because frankly men can even die from biopsies.
I didn't know that.
So we had a doctor from England that came over, and this particular doctor went to a famous center on the East Coast, and he had an elevated PSA. And he was biopsied there and never left the hospital. I mean, this is a shame. The sad part about this is he only had a 20 to 30% chance that he had prostate cancer anyway, and a 70 to 80% chance that he did not. So the bottom line is that we're taking patients and lining them up like they're cattle and treating them like cattle. These are educated men. These are undereducated men when it comes to medicine, and that's what has to change.
All right.
So, I mean, we want to stamp out ignorance for sure, and we want doctors to become better educated on the topic.
Fascinating book, and again, it is called Men at Risk, The Dirty Little Secret, and available right now, you said on...
It's available through the website menatrisk.net, and the ebook will be available on all the tablets probably within a week.
Oh. fantastic. Well, thank you so much for joining and sharing with us this afternoon.
I appreciated the opportunity, and I'll look to come back again soon.
All right.
Thank you.
Thank you. We'll be right back.